Hi, this video is going to take you through the basic observations that were done on a trauma patient. Observations are the assessments that you do to look at the signs that a patient is showing of how well they are. They're easy to monitor and they can be monitored continuously, giving you a good picture of the patient's condition. The first of these is heart rate. This is assessment of how quickly the heart is beating. You would typically either assess this by placing ECG pads on a patient's chest or by placing an oxygen SATs probe on their finger. If you don't have these available, you can place your hand on the patient's wrist and assess their pulse rate. The patient's heart rate may increase if they require more oxygen to their tissues, and oxygen is carried by blood. Therefore, the heart rate would increase in order to try and increase the oxygen that is carried to the tissues. If the patient is bleeding, for example, their heart rate is likely to increase. The next is the patient's blood pressure. This is usually assessed by placing what's called a sphygmomanometer on the patient's arm. This is usually electrical, although it can be done manually. If you do not have these available, ATLS gives some guidelines on how to predict the patient's blood pressure. If you're able to feel a carotid pulse, which is in the neck, you can be sure that the patient's blood pressure is around 60. If you can feel a femoral pulse in their leg, then it's at least 70. And if you can feel a radial pulse at their wrist, it's at least 80. A drop in blood pressure can be caused by a number of things, including bleeding, a head injury, or what's called a tension pneumothorax, and the mechanisms of these will be explained later on in the course when we talk about these injuries. The respiratory rate is how many breaths the patient takes in a minute. This is usually done by physically counting the number of times that a patient breathes, although if they've been intubated and are on a machine, then the machine may be monitoring this for you, or indeed performing the patient's breathing for them. If a patient requires more oxygen to their tissues, their respiratory rate will increase. And this may be caused by hemorrhage, similarly with the blood pressure and the heart rate, or by damage to the lungs. The oxygen saturation is the amount of oxygen that is in the patient's blood and reaching the peripheral tissues. This is normally done by placing a probe on the end of a patient's finger to monitor the saturation of the blood with oxygen at that point. You would normally expect this to be above 94%, but it may drop if the patient is bleeding, if they're having some breathing difficulties, or if they've got a long-term pulmonary condition such as COPD, or indeed if they've got nail polish, as it means that the sensor is unable to read as accurately the oxygen saturation through the nail. AVPU is a way of assessing the patient's alertness. It stands for alert, voice, pain, or unresponsive. This is a rapidly used method, so you can quickly tell if your patient is alert, if they're responding to your voice, if they respond to pain, or if they're completely unrousable. The Glasgow Coma Scale, or GCS, is a more complex system of monitoring a patient's consciousness, ranging from 3 to 15, and will be explained later in the course. If a patient's consciousness level is decreasing, then it may indicate that they have a bleed on the brain following a head injury, or indeed that they're bleeding and so are not receiving enough oxygen to their brain. Temperature is something that is commonly measured in healthcare, and it's particularly important in trauma. This is because a low temperature can lead to worsening of blood clotting and therefore more bleeding, and this is part of what's known as the triad of death in trauma patients, which is hypothermia, or low temperature, coagulopathy, or this is the bad blood clotting, and acidosis, which is caused by not enough blood reaching the peripheral tissues, and so you begin to produce acid, which again worsens your blood clotting, meaning that you bleed more. If you have a bleed, then your blood volume will decrease, and this will mean that your tissues get colder. So a patient who is hemorrhaging is likely to have a low blood pressure. This is typically assessed using an in-ear thermometer. So when you bring all these together, a major hemorrhage patient is likely to have a high heart rate, but a low blood pressure. They're likely to have a high respiratory rate because they are trying to get more oxygen in, but they'll be unsuccessful, so their oxygen saturations will decrease. As they're not oxygenating their brain, their consciousness level will be decreasing over time, and they may start alert but may end up unresponsive. And their temperature will be low as they have less blood in their body to keep them warm. These are the basic things that are seen in a trauma patient, and this is a way to monitor them. And if you can get your head around these, you can understand how well a trauma patient is coping. Although these are liable to change, and this is why they're continuously monitored throughout the time that a patient is in hospital.